Well, what's your skin saying about you? Turns out it may be a lot. Aesthetic plastic surgeon Dr. Z. Paul Lorenc is joining us to shine some light on the subject and some ways to help out our skin. Thank you for joining us.
My pleasure.
Okay, we were just talking before, and I'm talking to you about cellulite, which is my biggest enemy. I want to know, what does cellulite say about you, especially, you know, for the person who always works out or tries to eat well? What does that mean? My skin's screaming.
I know, but in spite of having done everything, exercising and watching your weight and living the right lifestyle, not smoking, you can still have cellulite. Luckily, we have solutions. We have also, not only do we have topical solutions, but they're really minor improvement when it comes to topical solutions. We have non-invasive solutions, such as PelleFirm by Ellman, which is radiofrequency energy that's delivered to the skin, and it gets rid of the cellulite. It's recently FDA approved. We also have a little bit more invasive techniques, such as CelluSmooth, where I deliver the laser underneath the skin, break up the bands that cause the cellulite, melt the fat, and shrink the skin, and that's a permanent change.
I mean, you could see a world of difference just in the picture that we saw, that it definitely works, and I'm a little bit afraid of needles and things like that, and you talked about it not being painful.
It is not painful because it's just delivered to the surface. Again, it's radiofrequency energy that's delivered to the surface of the skin, multiple treatments, but it's a beautiful result as the picture showed you.
So talk to me about sagging loose skin. What does that say about your lifestyle and diet, and how can that be treated?
Well, it's really a matter of degrees. Again, healthy lifestyle, no smoking, limiting alcohol intake. In spite of all of that, thanks to our parents, of course, you might have excess skin, and it's really a matter of degrees. Again, we have non-invasive techniques, such as SkinTyte by Sciton, where the infrared energy now is delivered to the skin, and it tightens the skin.
There you go. You could see. Look at that.
That's a very nice result, and again, that's from SkinTyte.
Wow.
And again, it's a matter of degrees. As we progress, at a certain point, if you choose to, of course, you can undergo surgical correction, which is a permanent, very predictable way to remove excess skin.
And talk me through some of these things that you have here.
Well, the most important thing about sunblock and sunscreens is that they have to have the right ingredients, such as the one by Elta MD. It contains UVA and UVB protection. It also has it also has a mechanical or a physical block, which is called zinc oxide, and also has a hydrating agent called hyaluronic acid, which is very important. And all of these products are very good. They have to be above an SPF of 30.
That's important to remember, right?
Very important. But again, UVA, UVB, a physical sunblock such as zinc oxide, and hyaluronic acid to hydrate the skin.
All right, Dr. Lorenc, you're the best. Thanks for joining us.
Thank you.